Hello everybody, my name is Lizzie. I'm a Community Sports Development Manager for BH Live. We run sports and leisure facilities across Portsmouth, but almost Bournemouth and Poole. I've been kind of working in the health and wellbeing / sports coaching industry for about 10 years. Through kind of various projects, initiatives, a lot including health and wellbeing. And I've also seen how active communities and being active can help on an individual level. I joined Shaping Portsmouth in 2019 to become a chair on the Workplace Health and Wellbeing project. We've got some amazing members on our team, and we want to be able to create kind of a set of sustainable programs to support any size business in the city to help keep their workforce happy and healthy. Shaping Portsmouth, just a little bit of background. I know I've got Ashley and maybe a few others, staff as well on the call, but it's a non-for-profit company whose vision is to make Portsmouth the UK's leading city to invest, live, learn, work and visit. Hopefully I've done you guys proud for that. Kim has pretty much smashed through a lot of what I will be talking about today. Next slide, please. Next slide. Perfect. So we spend more than 42 hours a week at work, 5 hours longer than our Danish cousins. So obviously a lot of our time is spent at work. So it's important to think about our health and well-being at work. And obviously we all should take care of each other in that respect. The importance of preventative health has been highlighted recently, especially during COVID and pre-COVID. Employers are in a well-placed to make a big difference by driving positive behaviours such as regular health checks, encouraging taking breaks, nutritional advice and increased physical activity. So I will be talking about the impacts of workplace health and wellbeing and also what the future holds post COVID-19, because it's important that the landscape has changed and we are all aware of that. I'll be kind of asking the question, have workplaces changed their priority list? And that's definitely the case. Next slide, please. So what does a healthy workplace mean? So obviously we know the 5 pillars to well-being, but what does an actual healthy workplace look like? There are 4 aspects that we must consider. So mitigating safety concerns. So this particular pillar or post is prevalent in manufacturing and labour-intensive jobs. So, for example, groundsmen, is there kind of risks in place that you can help mitigate those risks? But also it can be prevalent when it comes to desk jobs as well. Does your company make health and safety part of their culture? Do we make sure that all desks are also suitably organised for each staff member? We do know that musculoskeletal conditions, including back pain, neck pain and upper limb problems, causes 28.2 million days lost. So that's 21% of sickness absences. So there's a lot there that we can do to help with those safety concerns. And later on in the presentation, we will battle some of those aspects. So workplace culture, this is a huge part in which Kim touched upon, and it's really good to see Citizens Advice actually implementing a lot of stuff for their employees. But what are the company's missions and values? Does the company follow their own beliefs, behaviours, attitudes? What are the line managers' attitudes towards health and wellbeing? And also, most importantly, do your employees have a say, which is obviously extremely important. So in terms of staff wellbeing concerns, stress and mental health is a huge part, and Dr. Richardson touched on those, the mental health side. Financial wellbeing, again, such a huge part of those wellbeing concerns, and financial wellbeing, obviously post-COVID, is really highlighted to be quite difficult. We've obviously got mental health conditions as well. We've got stress, depression, anxiety. This resulted in 11.54% of sickness absences. So 3 out of 5 employees experience a mental health condition because of work. So that's actually quite high. Personal health resources, so this is another aspect that we have to consider. So in terms of personal stuff, I'm obviously quite engaged in terms of physical activity. So does that particular individual have access to being active? Counselling as well, occupational health services, and also food. What are people eating? Because that obviously has an impact on their sleep patterns, on their activity. Obesity levels are a huge problem at the moment. So there's a lot there that kind of links in together. We could include people who have a disability or long-term health condition as well. So that's a huge part of going to work. A lot of people do have hidden illnesses, and developing line manager knowledge about those illnesses does currently remain a challenge. And surprisingly, I love a statistic, so I will go through quite a few of these today. But just 42% of people say their organisation have a supportive line management style that treats people as individuals. So this is pre-COVID, and I will talk through the differences as part of that. Next question, please. Next slide, sorry, please. I was copying him then. This might be a silly question to ask, but why is workplace health and wellbeing so important to businesses, to individuals? And the answer is pretty simple, a lot. So as you can see, there's a huge cycle here in terms of the benefits and also the economic development as well. So it's a simple question to ask, but let's just highlight what it can help with. So it reduces absences. So obviously it can reduce absences by 42%. So if you are supporting your current employees, 42% is quite high. It improves productivity, so it helps issues become quickly resolved. Simply by eliminating that stress, that worry, it can lead to an instant boost in productivity levels. It reduces staff turnover. Obviously, time is money. Takes time to hire new staff, takes time and money to retrain. So why not look after the current staff that you have? It's so important. Customer satisfaction. I used to work in a restaurant, and we used to have a saying, it's the people that make the chicken. So if your staff are happy, then they will put the love and care into those products. And therefore they will keep their customers happy. No guesses as to where I used to work, but it was an amazing company, and a lot of stuff that they implemented. Their values were really strong in terms of making sure that they put the staff first, because at the end of the day, you then get your repeat customers. Also the lack of cost associated, that's a huge thing, links in with time is money. So there is some costs that Kim did mention earlier in terms of purchasing, perhaps wellbeing programs, purchasing counselling, that kind of stuff, or health plans. There are some costs associated, but actually throughout my presentation, you'll see there's little things that we can do to make a big difference. And I think that's quite key. Next slide, please. So we, as part of Shaping Portsmouth, put together in partnership with Energise Me, who are our county sports partner, so they look after health and physical activity in Hampshire. And everyone loves some statistics. I'm hoping you're all able to see these, but don't strain your eyes too much. But we put together some statistics that I'd quite like you just to have a little look through. I'll give you a minute to read these statistics. These are locally and nationally as well. Are there any particular ones which might shock you? If you could write these into the chat for me. It's really highlighting in terms of the problems that we do face as businesses. The ones that particularly shocked us, and we put this out to 42 businesses in Portsmouth, and the deaths caused by physical activity was a huge shock. And the amount of time British people do sit per day is another huge shock. So I'll give you a minute just to read through them. And if you could comment in the chat box anything which particularly surprises you, anything which you weren't aware of, that would be amazing. I'll give you a minute just to do that. Was anyone particularly shocked by any of these? If you could raise your hand as well. Thank you, Tom. Thanks, Sandy. So 4.2 million lost through back pain. That's such a huge part. Obviously, manufacturing industries tend to report the most days lost throughout back pain. You've also got groundsmen as well, who do report a lot of those numbers. Also, things like getting someone to double check occupational health in regards to looking at desk, how you're working. Obviously, we're all working from home now, a lot of us. So what is our work setup like from home? Thank you. Thank you, Lucy. Thank you, Sandy. Yeah, surprising about the mental health days lost. It's such a huge part at the moment, and we are more aware of mental health now more than we ever have been. So it would be interesting to see that safer mental health culture. I'll talk through a little bit about that later. Thanks, Sandy. About 53% reporting stress. And obviously during COVID as well. Perfect. Thank you, everybody, for taking part in that. It's just, we actually put this out to 42 businesses in Portsmouth, and a lot of them had answered questions about this, and they were actually really shocked as to a lot of these. Some of these weren't particularly shocked in terms of what's happening in their businesses. Some of them say, yeah, actually, this sounds about right, and they weren't actually too shocked, but then it's putting something in place to be able to prevent that as well. Thank you, Payman. Yeah, that particularly shocked me a lot, coming from a physical activity and really active background. 8.9 hours average time British people sit per day. That was a huge shock, and businesses were actually quite taken back by that as well. I'm quite passionate about physical activity, which many of you may or may not know, but I do have a coaching background, so I'm quite active during my day, but that was something that was quite shocking. Perfect, thanks everyone. So next slide, please. So you might have to pick a few times for this one, but if you could pick once for me, yeah, perfect. So I'm just going to go through pre-lockdown statistics to compare pre and post-lockdown, and what businesses have currently changed on their agenda. But 61% of businesses had employee wellbeing on their agenda. That was pre-lockdown, so a lot of them actually said that they were particularly keen on the importance of workplace health and wellbeing, what that meant to their business. Next little clip, please. So 58% of senior leaders have said they will buy into the importance of wellbeing. So Kim mentioned previously about costs, and there's a huge part to say in terms of the importance of buying into that. Next clip, please. So public sector organisations are the most proactive in wellbeing, although most of these, to be honest, most of these organisations are actually under the most pressure. So we have people in the education, police, fire and healthcare sector / organisations who are under the most pressure. So intervention, you would argue, is probably necessary in terms of the high staff turnover levels. So yeah, that's kind of not too much of a shock in terms of that, but actually it shows that hopefully businesses are doing something to help. Next slide, please. Next click, sorry. So pre-lockdown, most companies found their employees were off due to long-term health conditions as well as mental health. This isn't potentially too much of a change compared to now, but I was quite shocked in terms of long-term health conditions and how managers are managing that within their business. Obviously back conditions, that being one, but also a lot of people do have mobility considerations, how they should have their desk, that kind of stuff. So there's a lot to it in terms of the mental health side, but long-term health conditions as well. And actually Simply Health, Championing Better Work and Working Lives along with Simply Health did actually some research around this and about managers having that knowledge around long-term health conditions, because that's another thing where perhaps we don't take the time to sit down and learn about what people's long-term health conditions are. Do people disclose them? So there's issues around that as well, which I will talk about a little bit later. Next slide, please. So post-lockdown, obviously we had COVID, a lot of people were off work, a lot of people had to change their ways of working, and there's a lot of wellbeing factors that were pre-COVID compared to post-COVID that we now need to consider. COVID has changed a lot for businesses, we are all aware of that, but previously we had 61% of businesses who had employee wellbeing on their agenda, and it's now moved to 75%. So this was a questionnaire done by Championing Better Lives, and they did a questionnaire pre-COVID and post-COVID with 250 businesses. So 75% now say that they're thinking about employee well-being post-lockdown, and more businesses, that's 83% of businesses, are offering tailored support as well. So it shows that there has been a shift, and many businesses are bringing that up on their agenda a little bit more in terms of workplace health and well-being. We also found that 67% of businesses, senior leaders to be precise, have said that they would buy into the importance of well-being. So that was pre-COVID 58%, so you can see a shift in the percentages there. There are still other factors to consider that have been a health and well-being issue for staff, but now more than ever. Like I said, a poll which was done by Management Today and a few other organisations said 87% say they have experienced increased numbers of staff disclosing issues around poor mental health, and 82% saying they've seen a greater number of staff reporting feelings of loneliness. Obviously most of us have now changed our ways to working from home. And this, in terms of this has changed some wellbeing factors and some shifts. So obviously you're used to that busy and bustling environment, but you've now gone to them working from home. There isn't as many people around in the office, so that has made it quite a lonely place. But research has found the following pointers to combat loneliness. So wellbeing is obviously key. Values are vital as well. The provision of technology, which is something which people might not have access to. There was a lot of stuff done when children had to learn from home. They didn't have tablets, they didn't have that kind of stuff to be able to then access those learning from home. So that was quite difficult for a lot of individuals, a lot of students as well. They might not have had access to Teams or Zoom. So the provision of technology is really important to help combat loneliness. And effective communication as well. So that's key, coming from line managers and communicating and talking to their employees, even though they're in separate areas now. It's quite key to have those catch-ups and think about having weekly, monthly, however that looks for your business. But those catch-ups are really important to feel like you're included as well, because I personally didn't work from home. I was put on furlough for 2 years. And then I have to do a lot of my face-to-face delivery, but I can imagine, obviously with loneliness, it can be quite difficult. Obviously, Dr. Richardson did touch on money problems affecting a lot of people, so financial stress. This is no matter the level of pay as well. So no matter how much you are paid in your business, you can still have that financial stress. So it's worth thinking about. Money problems cost the UK economy 120 billion per year, and 17.5 million hours are lost, taken off of work because of this financial stress. So that's a lot of money, excuse the pun, but it's a lot of money. And financial well-being, unfortunately, still remains a neglected area. Nearly a quarter, or 23%, report their organisation has increased their focus on financial wellbeing. And there are only small improvements in activity to promote financial wellbeing. So a lot of businesses do signpost to external sources of advice, business advice being one as well as other businesses. This can remain quite a hard area. Employees can support though through other types of support, access to regulated advice, financial products, services, perhaps cost reduction schemes. Personally at BH Live, we're part of a health plan, and they will pay for dental procedures. I obviously have to keep myself quite active and fit, and I sprained my ankle a few years ago, so I had to go through a rehab process. They helped me pay for that, which was obviously quite expensive. So there's a lot of stuff businesses can do as part of that. Perhaps travel card or discounted memberships to gyms, to other areas. We at BH Live do a corporate membership, so we give discounts to businesses in the city to access all of our sites across Portsmouth. And discounted other travel card means as well. So obviously travelling to work is another cost to a lot of organisations and businesses and individuals. The findings also show an encouraging fall in the proportion that report their organisation is a much more reactive than proactive. So it's 27% down compared to 40% last year. Nearly half of businesses still lack some kind of formal strategy. So again, going back to the 4 aspects that I was touching on earlier, the mitigating those safety concerns is something that we might have to think about. Public sector organisations are most proactive. As I said, you do have the most stress going through the NHS, going through fire departments, education departments. So they are the most proactive in wellbeing, which is encouraging to see. But there's still a huge part that we can all play. Next slide, please. Perfect. So I would not be practicing what I preach unless we did do a little bit of exercise in this presentation. Obviously, this is my background. This is what I'm passionate about, and you can also implement it in business too. So obviously, I have quite a bit of room to do physical activity. But if you don't, I have 2 options. I've got seated exercises and standing exercises. If you do have a health condition, you should seek medical advice before you exercise, and please exercise at your own risk. So as I said, I've developed 2 exercises that we can do. So first of all, you can do this seated or you can do it standing, completely up to you. I'm going to show you behind chair 2 options. So first one we're going to do is marching. So this is where you do high knees on the spot. It's just a nice gentle exercise just to get your heart racing, hoping you're all joining in. It's a shame I can't see you all. But let's get those arms moving. We're going to go for 30 seconds. If you were seated, you're just going to simply raise your legs up and down for me. Okay, are we ready? 3, 2, 1, off we go. So raising that heart rate for me. You can do this as slow as you want to. It's important that we do keep moving, especially when we're considering that well-being within our workforce. We do know it has a lot of physical activity has a lot of positives in terms of mental health, forgetting about your task list that you have to do and just getting active. You can also speak to people as well whilst you're doing it. 3, 2, 1, and stop there. Well done. Next exercise we'll do is calf raises. So you're going to go onto your tippy toes, nice and gentle. You can see me kind of lifting there. Sorry, I have a table in front of me, so you might not be able to see. You can do this seated. You can hold onto your chair doing calf raises. Seated, you can do calf raises, lifting your knees up a little bit and getting onto those toes. So are we ready? 3, 2, 1, off we go. So calf raises up, 30 seconds. I normally have my hands in front or just to the side, wherever you feel comfortable. Again, if you're seated, you can do this seated. Just rolling onto your toes and just lifting up. So this is activating your calf muscle, keeping them awake, keeping that blood pumping as well. Hopefully your heart rate's gone up a little bit from your marching. I know mine has. Perfect, keep going. 3, 2, 1, and stop there. Well done. Next one we're going to do is side taps. So you're just going to really gently bring your foot out, alternating each side. You can also do this seated. So bringing your leg out to the side and back. So we're going to do that again for 30 seconds. You ready? 3, 2, 1, off we go. To the side and back. Lovely. Well done. Keep it going, everyone. So bring it out to the side, bringing your foot back. Nice. Well done. Make sure you keep moving. Perfect. So like I said, if you are in a cramped office, the office environment is a bit too much, you can do this seated as well. You can do some gentle exercises. 3, 2, 1, and stop there. Well done. Next one we're going to do, last one, and we're going to do some boxing. So you're just going to bring your arms forward, like so. You can do this seated, bringing your arms forward on each, okay? Are we ready? 3, 2, 1, off we go. So punching forward. Well done. Hopefully you're all doing this with me. Might be in front of the camera, but hopefully we can all feel the benefits of this. Well done, punching forward, not too long left, keep it going. Well over halfway. Nice job, well done. Almost there. 3, 2, 1, and stop there, well done. Perfect, so we will stop there. You can make this harder or easier, you can add resistance bands, that kind of stuff as well. We are running over slightly, so I will get a move on, as this slide says. But obviously, physical activity isn't the be-all and end-all, but it certainly can help someone to forget about work for 10, 15, 20 minutes, and also put their focus on somewhere else. But also, it's important for your physical and mental health and overall health in general. So that's kind of what I'm passionate about, bringing it into that conversation. It can reduce blood pressure and help manage certain health conditions, and it also helps you to sleep, which can be necessary for the next working day. Sorry, I'm kind of out of breath. I don't know about you guys. You can find some videos on YouTube as well, seated chair exercises. And we also plan on launching something for Shaping Portsmouth, and it'll be on their website soon, so you can follow that. Next slide, please. So I'm just going to quickly rush through some of the things that we can do to help in terms of the 4 aspects that I was referring to earlier. So in terms of mitigating health and safety concerns, thinking about risk assessments, it is boring, but it's necessary for a business. Thinking about handling regulations, thinking about manual handling. So actually, how do you lift properly? How does it prevent that back pain? Also COSH, so this is managing chemicals and how that looks in terms of your workplace. Also workplace culture and thinking about returning to work policies. Does your company do this? So after you're ill, does your line manager come over and actually have that meeting before you come back to work and say, how can we help in terms of sickness? Is it a long-term health condition? So there's no shame in asking. I just feel like it's healthy to have that conversation. Is there pre-leave handovers, and what are your managers' attitudes towards health and wellbeing? Like I said, we have a health plan as part of our company, which is amazing, which helps with dental and also therapy as well. So kind of thinking about the future and managing that. So staff wellbeing concerns, training, mental health first aid, which there's quite a few courses going around at the moment. Ergonomics, so testing your computer and desk screen and desk space at home. There's also been attitudes towards flexible working, especially post-lockdown, and referring on to other services. And then the last one, personal health resources. So this is things such as the intranet and also taking the stairs instead of the lift at work. Every little helps. And we did manage to visit Portsmouth City Council actually, and we told a guy to take the stairs. And it kind of improved his health and well-being. We kind of had to sit down with him and areas in which he wanted to work. And he said that his statistics were quite weak. So we did peak flow, we tested his fitness, and then we told him take the stairs more, be a bit more active. He actually lost 3 stone. His peak flow capacity had increased, his lung capacity, he was just such an amazing shape. And he said that mentally he felt in a better place. A lot of these issues do link in with each other as well. So this slide, we actually did a questionnaire to 42 businesses in the city, and we asked them what would a health and wellbeing programme look like for you. And these are some of the resources that they said might actually help them. We did actually train some workplace health and wellbeing champions. So we sent them on a MEC training course, which is making every conversation count. And in terms of goal setting, this was a really good course, and it helped them to help their employees goal set. This isn't a one-size-fits-all approach. Many businesses operate differently, and we do have to think about the different size businesses there are, but these are just some of the examples of that.
Sorry, Lizzie, we're probably going to have to cut a little bit because we've run into some time. Are you all right if we send this out post for the session for everyone so they can have a look?
Yeah, of course. Yeah, I know that's absolutely fine. No problem.
Perfect. Thank you very much for that. I, for one, feel a bit fitter. Probably my neighbours are wondering what I'm doing, running up and down on the spot.
Yeah, no. Hopefully our neighbours weren't looking in, but
that was really appreciated. Thank you very much for that. And we'll make sure all of this goes out as well with the slides. So I'm going to try and incorporate some calf raises in my day.
Perfect. Thank you so much for having me, everyone.
Cheers.